Come on, Mom, you got this.
Hand hygiene and providing privacy. Hi, my name is Brandy. I will be your student nurse today. I would like to do a head-to-chest assessment. It should take me no longer than 20 minutes, but it should take a lot less time. I am assessing to make sure that everything is working okay. Is that okay with you?
Yes.
Okay, first I would like to start with identifying who you are. Can you tell me your name and date of birth?
I'm Nadine K. October 17, 2004.
And do you have any allergies?
No.
And if you had any pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain, how would you rate your pain today?
0.
0. Okay, so now I'm going to move on to her general appearance. So looking at her, she's standing erect. And I'm going to, I see no signs of acute distress. So can you tell me what year it is?
2020.
Can you tell me who the current president is?
Donald J.
And do you know why you're here today?
Yes.
Can you tell me why?
Check up.
Okay. So according to her responses, she is alert and oriented to person, place, time, and situation. And based on her facial expressions and her mood is appropriate for this, her behavior is appropriate for this assessment. And based on her response to me, her speech is clear. So now I'm going to move to your skin and your nails, if that's okay with you. So I'm looking at her skin, her skin tone is appropriate to race. I do not see any wounds. I do not see any lesions. Have you had any recent surgeries where you might have any incisions?
No.
Okay, no lesions, no wounds, no incisions. Can I touch your skin? And I'm palpating her skin for temperature with the back of my hands. And she is of normal warmth. So then I'm going to move to your nails, if that's okay with you. So on each hand, I will push down on her fingernails. They are of normal color to her race. They're appropriate to her race. And when I release her nail beds, her capillaries refill within less than 2 seconds. So her capillary refill is good. So now I would like to check for clubbing. So to check for this, I would like you to have you touch your nail beds together. And I see no signs of clubbing. My patient does have artificial nails, but for the purpose of this video, I just verbalized everything that was going on. So her skin and her nails has been assessed. Now I would like to move on to her head. So is it okay if I touch your head? On assessment of her head, I'm looking for lesions and I'm looking for infestations. I do not feel any lesions and I do not see any infestations. And she is of normal cephalic. Her facial structures are symmetrical. So as I move from her head, neck, and face, I'm going to move on to her eyes. As I look at her eyes, her sclera is white. Can you pull down on your lids? Her conjunctiva is pink. I see no redness. I see no drainage or discharge. I'm going to assess her pupils at this time. So when I look at her pupils, they are both round and they are both equal. And I measure them both, her right and her left, at being at 4 millimeters. So as I check for reactiveness to light, I'm going to move my light closer to her eye, and her pupil constricts on both her right and her left. And if you could do me a favor, follow my pen to your nose. So with assessment, I would say her pupils are equal, round, reactive to light, and accommodating. So as I move from her eyes, I would like to move to her ears. So I'm going to look at her left ear, and I'm looking at her right ear. I see no discharge, and based on her responses to our conversation so far, I do not suspect loss of hearing. Do you have any difficulty with hearing? No. So her hearing is fine. So as I move from her ears, I would like to move to her nose. Can you look up for me? So I'm looking at her nose. Her septum is in place. I would say that her nose is symmetrical. If there's no deformity, I see no redness or swelling, so there's no sign of inflammation, and there is no drainage. Can you occlude one side for me and take a breath in and out? And can you do the other side? And she has bilateral patency of both nostrils. Can you say ah for me? Looking at her mouth, her lip, tongues, and gums are pink and moist, and I see no lesions or signs of dryness. So everything looks good for me from that point. Is it okay if I check your respiratory system?
Yes.
Okay, so I'm looking at her breathing. Her breathing rate is regular, it's unlabored. I see no signs of her using accessory muscles to breathe. Now I'm gonna listen to you, okay? So with the diaphragm of my stethoscope, I'm gonna start at the apex of her right lung. Take breath in and out. And this is done in a Z pattern, usually to bare skin, but for the purposes of this video, she's gonna keep her shirt on. This is her right upper lung, left upper lung, right middle lung. This is left upper lung still. Right lower lung, left lower lung. Okay. Anteriorly, she is clear bilaterally. Can I have you turn around for me? In the apex of her left lung, in and out. Apex of her right lung. And in between her scapula in a Z pattern once again, I'm going to listen to her left upper lung. And I'm avoiding her scapula to osculate her lung. Right upper lung. This is left upper lung still. This is her right middle lung. Left lower lung. This is her right lower lung. Posteriorly, she is clear bilaterally. Okay, now I'm going to move to your cardiovascular system. Is that okay with you? Mm-hmm. Okay, I'm going to palpitate her carotid one side at a time. I would say her rate and rhythm is regular, +2. I'm going to check your radial pulses. Her rate and rhythm is regular, +2. And if we were to do her JBD, I would have her lay down at a 45-degree angle. At this point, I'm looking for jugular vein distension. It should be flat when she lays. I would have her turn her head, and I would look for the vein to go flat. If it is distended, then it would be a positive for JVD. And as I'm looking at her, can I have you turn the other way? Both sides bilaterally has no signs of JVD, assuming that we were at a 45-degree angle. So then, if it's okay with you, I would like to listen to the valves of your cardiac system. Is that okay? Mm-hmm. Okay. So, once again, with the diaphragm of my stethoscope, I'm going to come to her right second intercostal sternal border and listen to her aortic valve. This is her S2 sound. Then I'll move to her second intercostal left sternal border for her pulmonic valve. Again, this is S2 sounds. Then I move to her third intercostal left sternal border for her Erb's point. Then I move down to her fourth intercostal left sternal border for her tricuspid valve. And then I will come to mid-clavicular fifth intercostal space for her mitral valve. This is the S1 sounds, both her tricuspid and mitral. I will listen to all the points once again with my bell. Okay, with my bell, I hear no murmurs. S1 and S2 was heard clearly. And at the closure of my assessment, I would like to reassess any pain that you might have, 0 to 10, 10 being the worst, 0 being no pain. Any pain right now? What would you rate from 0 to 10? I'm going to hand you your call light. I'm going to Lower her bed to the lowest point. I'm gonna lock it. I'm gonna raise rails. I'm gonna thank you for allowing me to assess you and hand wash.